Hello and good morning. Thank you so much for joining us today. Hola, buenos días. Gracias por reunirse con nosotros hoy. Today we're going to talk about PET-CT molecular imaging, theranostics, and more. My name is Frances Vargas. I will be your presenter today for today's lecture. So I am an ODU alumni. I graduated in 2003 from the Bachelor of Science program with nuclear medicine. And ever since graduating, I have worked with Centera Healthcare and also have specialized in cardiology, in pediatrics, in oncology and neurology exams. We've grown as a department. We have grown as a profession in nuclear medicine and PET-CT. So it is an honor to be here presenting for you today. So in our objectives for today, what we're going to be discussing is a brief overview of what PET-CT imaging is, the current diagnostic tools, the future of PET-CT with theranostics in research, and also its impacts to the Hispanic and the Latino population. So what is PET-CT imaging? So it's not quite what is visible on the screen. A lot of times we are asked if PET imaging, if patients can bring their pets, so that way we can scan them. So unfortunately, that is a misconception. That is not what PET imaging is. So I think this is a very funny meme just to kind of put that question out of the way. We are not imaging your family pet. We're not imaging a zoo animal or anything of that nature, but instead we are actually performing diagnostic imaging on patients. So this is a very brief overview. I will not go into detail or a lot of specifics of what PET-CT imaging is, but it's actually a very exciting field to be a part of. If you like physics, if you like anatomy, if you like chemistry, and if you like patient care, so you like the technology aspect of things, but then you like the sciences as well, I found that this is a really wonderful profession in merging the two. So how I like to describe PET-CT to my patients, to my family, to my friends, to kind of explain what I do, is I perform imaging, and I perform imaging by giving patients radioactive material. Yes, ladies and gentlemen, we make people glow. And so we make them glow. They are not able to see themselves if we turn off the lights and glow in the dark, but instead we use the technology that has been given to us, such as a CT scanner, which performs an axial or basically a 3D image for us. And then the PET scanner, which we inject a patient with a radioactive tracer. And then the camera takes up that information and puts it on a screen for us. On the bottom, what you are able to see is on the left-hand side, the picture that is has a white background with a gray and black outline of the body. That is actually a PET image. So what we do in this specific case, we give patients a radioactive sugar. It travels throughout their bloodstream, goes into their heart pumps it out, and takes it to the rest of the body. As it goes to the rest of the body, the cells kind of trap up all of that radioactive material, and it gets trapped to where it needs to go. We are then able to see the image on the bottom left. The image in the middle is your CT scan. So that's kind of, if you think of a coloring book, a CT is that. It gives a doctor and it gives a patient the information of detail of where organs are in the body and how big, how large they are, if they're abnormal or if they're normal, and gives a specific location. This is helpful for patients who are getting pictures because of either cancer or if they're having pictures to determine activities of the brain. We're able to see the specific structures. So that's kind of like the black and white lines of a coloring book. And then with PET, we color those lines in and give it all of the pretty pictures. So the image on the far right is actually the image that has the bright orange and the bright red and the different shades in between. So that is, ladies and gentlemen, a hybrid image, or an image that has been fused together. So with the technology of PET-CT, we combine the best of both worlds. We combine the specifics of CT, which is the black and white lines of a coloring book, and then we color in those lines, which represents what the cell has taken up, and that is the PET image. So we grab the CT, we grab the PET, we superimpose them, and then we're able to see if there's anything that lightens up and where it is in the body. So, para mi gente, my Latino friends here with the REYES program, thank you again for joining. A couple of fun facts that impacts our patient population and our Latino family members and friends. So if you did not know, 42% of cancer cases and 45% of cancer deaths in the US could potentially be prevented. Unfortunately, with the Latino population, there are some limitations. And so we see this really high statistic that impacts our community. So as a Latino member, or even just as a community member, there's a lot of technology that we are seeing with PET-CT that actually plays a huge impact to the care and to the treatment of our patients and our community. So with health disparities in the Latino population, 1 in 3 will be diagnosed with cancer. 1 in 5 Hispanic men will likely die from cancer. 1 in 6 Hispanic women will likely die from cancer, and 2 times more likely to develop cervical cancer. So as you can see, I don't like these odds, and I'm sure that you don't like those odds either. However, I would like to share that with the technology that we have now, we are able to diagnose, we're able to find, we're able to treat these different types of cancers earlier on. And with all of the research that we're seeing with Theranostics and with research in general, we're hoping to be able to change these statistics. As a fellow Latino member, and with your endeavors with ODU and wherever your career takes you, there's a lot of research and technology and impact that you can play. So a little bit of a deep dive. Again, I'm not going to give so much detail, but you're kind of wondering, what is this image? Okay, so you perform a PET scan. What are we looking at? So the image on the left is a normal FDG scan. Whenever you give patient a radioactive material, it's going to normally distribute or normally travel through the body in a normal fashion. So the image on the left is what we expect to see. The image on the right, which is actually a case study, we're able to see with the use of PET-CT technology. Prior to PET imaging, physicians were not able to see what was going on at the cellular level of a patient's body, what the cancer cells were actually doing. Prior to PET-CT, all that they had was a CT scan that just showed change of structure. But unfortunately, whenever a change of structure occurred, it was kind of already advanced. The cancer was pretty advanced. But with PET-CT, we're looking at the molecular, cellular level before those changes happen. And we're able to see what those cell changes, how they act in the body, and how the doctors can use this technology for being able to find the cancer, treat the cancer, and improve the survival rate for our patients. So on the left-hand side, this is called the baseline study, AKA the first scan a patient has whenever they're told they have cancer. This patient unfortunately has lymphoma, which is a type of cancer that impacts your lymphatic vessels, which are actually organs that are all throughout the body, and they're part of your immune system. So everything that you see that looks like a chain that goes all the way up from the really bright spot on the top, which is the brain, all the way down to the bottom, which is down to the thighs. This patient has a widespread cancer. The doctor was able to see this and determine what's called a treatment plan, or how do they now battle this cancer, right? How do they move forward to try to improve the chances for these patients? So the patient went through chemotherapy, and after several cycles of chemotherapy, the image on the right, you actually see the same patient return several months later. And as you can see, all of those chains and the high uptake, those really bright pictures all throughout the body have now diminished. So what that has shown is that the cells of the body have responded or have improved and have those cells have been treated appropriately. So we're not able to see the cancer expressed how it was before. So for this patient, this is wonderful, wonderful news for this patient. And with the technology of PET-CT, we're able to provide this information to our patients and to our doctors. Just a quick picture right here as well, which is what other malignancies or what other cancers and how they can be shown on a PET scan. Different cancers behave differently. That's just kind of how it works. And so this is just an example that how a PET imaging can be seen with patients that have been diagnosed with different types of cancer. So I threw the big word out, right? Our university adult word of Theranostics. So what exactly is Theranostics? So Theranostics has been a really big buzzword in the past couple of years. Basically, what you can think of is the image on the left with all the chickens, where you just basically kill two birds with one stone. So on the left-hand side, it represents a pathogen or a cancer or something that attacks the body. But with Theranostics, the wonderful thing is that with the science of radiopharmacy labeling and with the technology of imaging and treatment, we have now the ability and the capability where we are able in PET-CT with imaging, finding the cancer. So that is the chicken that is knocked over on its back that says diagnosis. That is us in PET-CT finding the cancer with that specific radioactive medicine that we give patients. When we find the cancer, we're basically able to identify or show the cell of the body that has that cancer. So what happens is then the doctor can create a treatment plan, or how can we fight this cancer? So then that's the treatment plan chicken, that by using that same chemical property of that ligand or that tagging of that radioisotope, we're now able to treat that specific cell. This is wonderful because prior to this, the only treatment options patients had were chemotherapy, which what happens with chemo is patients are given medicine to kill off all the bad cancer cells. But unfortunately, it also kills the good ones too. And so that's why you see patients lose their hair, become very weak and ill. With Theranostics, it's targeted. So just the bad cell. You're not killing the good cells. So this is huge, and we're very excited in PET-CT to be a part of this imaging. On the right-hand side, you're also seeing kind of a visual on how it looks on a cellular level. So you see on the top, what's called a radio hybrid, or basically kind of what the radio, I'm trying not to use the big words, I'm trying to keep it not complicated, but basically the radioactive medicine or the chemical property of how that radioactive material is made and how it is going to be taken up in the body. With PET-CT is how we identify it. So with PET, we identify it, then that exact chemical property, then on the bottom with Theranostics value, we're able to see the radioligand and we're able to zap it with radiation therapy. So with PET, we find it. Then after we find it, then we can zap it. So if you just think of just that simple analogy with Theranostics, you'll be able to understand the value of PET-CT imaging and where PET-CT is going and the impact to our patients. This is an example of a type of scan that is actually it's newer to the market. We've started doing this back in 2016, 2017. So this is a very specific test, which is called a gallium-68 dotatate, which just identifies that radioactive material that we gave our patients. Prior to PET imaging, the images on the bottom that are in blue, labeled Octreoscan and I-123 MIBG, were the tools that the doctors had to be able to find cancers that were of the properties of neuroendocrine tumors. Before that, as you can see, it's a very fuzzy image. You can't really identify and see where it is in the body, what's normal, what's abnormal. So it was, it's kind of hard to really kind of see what is abnormal in this picture. How can we help this patient? Thankfully, on the right-hand side, you see labeled in red gallium dotatate. That represents the new technology or the newer technology, which is gallium dotatate imaging. As you can see, this is the same exact patient, but you can clearly see the images are very, very different. A lot more dark areas, a lot more specific areas. So what we're able to see is with the advances of PET imaging and the radio labeling and the chemistry properties behind it, we were able to find those specific cells and we're able to identify that this cancer is actually pretty widespread. And the doctor can then determine how to treat this patient. So we are able to find and identify those cells. And now the doctor can create the treatment plan with Theranostics and give the patient a specific radioactive isotope that is actually higher in power, more potent, and can kill off those cells. Theranostics, recently you probably heard the news of prostate imaging. This is a huge breakthrough. And I know you've probably heard me say the word huge a lot with PET-CT, but it really has played a big impact to our patients, specifically for patients with prostate cancer. So just another bit of factual information. So most commonly diagnosed cancer in Latino men is actually prostate cancer. This is something that is near and dear to my heart. My dad was diagnosed with prostate cancer. Thankfully, they found it early and he's been able to recover from that. But prostate cancer is a significant burden for Latino men. Some of the barriers are early screening, access to educational materials, and if diagnosed, is less likely to receive optimal treatment. That is just because of the barriers that we see sometimes with our population in the Latino community. But by 2060, they're expected these numbers to quadruple in Latinos, which face the largest increase per the CDC, 3.5 million Americans, Latino Americans impacted in the US. So as you can see, this is a potential healthcare crisis. This is really something that's a high incidence and high prevalence in the Latino community, especially in the Latino men community, male community. However, what we've seen with PET-CT is now with prostate imaging, there is now a specific medicine. F18 is how we make it glow, or the technology of how we're able to make it visible on the scan. And with PSMA, which is actually a very specific antigen to prostate cancer, we're able to identify not only cancer in the prostate bed, which is actually an organ or a gland that men have that is actually right behind the bladder. And so before this type of imaging, it was very hard to identify early, or if it was identified once it was pretty advanced and the treatment options were very limited. With prostate imaging, what we found is we can actually find it early, and we can actually identify how widespread it is in the body. So just another visual, I'm a very visual person. On the bottom left-hand side of your screen, what you're able to see is the word SPECT, which stands for single proton emission computed tomography, very big word, but this is a type of nuclear medicine imaging. You're able to see a lot of dark colors, and right in the center of the body, you're able to see two organs next to each other. Those are the kidneys. Right below that, where the red arrow is pointing, it's pointing to the bladder. Right above that, you see a little dot. And so what you see with that little dot is you actually see the mapping of prostate cancer that has returned to the patient. But in that image, that's the only area that you see. If you look above that, where it says PET imaging, this is the same patient where you see those two bright organs next to each other, which are the kidneys. But then in between that, you see a lot of little dots that look like marbles. And underneath of that, you see the bladder. So as you can see, not only do you see the dot that was identified on the bottom with the arrow, but you actually see several other areas that are bright. So this, unfortunately, is metastatic, which means that the cancer has spread through the body. And so by seeing this picture, the doctor can determine, wait, not only is it just in one area, it's actually further out. So that changes a doctor's way of how they treat our patients. So that has played a big impact, PET imaging, of being able to improve, to find cancer. And then with therapy, they're able to treat that cancer specifically, and kill off the bad cells, keeping the good cells intact. And then in surgery, on the bottom right, they're able to then remove those areas specifically, and have a very good response to treatment. So with theranostic and prostate imaging, PET PSMA is how we identify it. Lutetium is how we treat it and how we zap it. So you're going to see a lot of discussion with prostate imaging and PET imaging and theranostics, especially with this most recent and first FDA-approved isotope in the US. So we've talked about some oncology. Oncology means cancer, items in the cancer field. Now we're going to move forward to dementia. And so with dementia, that is items that where patients are impacted in their brain. So dementia is another word for memory loss, or if you have a family member or know somebody that has suffered from Alzheimer's, it's a disease that advances and impacts the adult patient population, but really the elderly patient population. What we've been seeing is a lot more people are becoming diagnosed or being identified to have this disease. But really, with the Latino population, we're seeing that 13% of US Latinos age 65 and older currently right now have Alzheimer's and or dementia. There's a lot of studies that are exploring Alzheimer's risk factors, biomarkers in Latinos. By 2060, it's expected also to quadruple. So this is, again, another very, very important item to be able to identify and see how we can help with research to help identify this disease early. That way we can identify what medicine we can use to treat, to slow the advancement or the progression of this disease, and improve the quality of life of our patients, of our grandmothers, of our grandfathers, of our aunts and uncles, to retain their memory. We know that that can be a big impact for our family. So another picture here, and kind of showing you with PET imaging what we're looking at. So if you look at the image on the right, you see a lot of bright, bright, bright colors. Remember the coloring book I was talking to you about? So the image on the bottom, that is actually a picture of the brain. And so what you see, gray matter and white matter of the brain. So with FDG, it's a type of PET medicine that we give and how it goes into the body. We then color in that coloring book with lots of colors. The image on the top, as you can see, it has a lot of red and green and orange. That is a normal brain. So that is how your brain should look like. And all of the colors show the cellular activity and basically of a normal functioning brain. Patients who show symptoms or come and present to their doctor or begin to have memory loss, forgetfulness, memory loss, forgetting, who they are, details of how to function, then impacts their quality of life. So what you can see, if you compare the normal image, which has the really bright ring around it, red ring around it, to the image in the center, it's actually a patient who has Alzheimer's, which is a disease of progression of memory loss. You can see where the yellow arrows are pointed, that red actually now becomes less bright or less avid of the FDG. And so it shows that those cells are not functioning, or they're not as avid. Those cells are kind of dying off. And so it's impacting that patient's ability to remember. And therefore, we're seeing memory loss in that patient. Another type of disease is frontal temporal dementia, which is the image on the far right, which is the acronym is FTD. And that's pointed out with the red arrows. So what you see is the area on the front of the brain is now low in redness, low in color. And so those cells are not functioning to the best of their ability and have been impacted. And that's why we're seeing memory loss on a patient. So until recently, until a couple years, this was the only really imaging that we had for PET-CT. But what research has shown is not only is it easily identifiable by glucose activity, or basically how much sugar your brain is taking up, um, it's also impacted by how your brain functions. And so your brain has tangles that helps with the communication between the neurons and all of the structures in between to be able to communicate. And so what they found with research is a more advanced technology. And so with that more advanced technology, what we were able to find is there's the radioactive material that I was talking about. It actually, you can bind it or tag it or combine it with another different type of medicine that is specific for plaque imaging or specific for other ways of how the brain is impacted, which are developments of plaque that kind of develop in an aging brain, or tau tangles that kind of become wired and literally become tangled up in the brain and impairs the communication of brain activity, therefore impairing memory loss and impairing a lot of other functions. So this is a breakthrough. This is, and we're very, very fortunate to have been able to participate and continually participating in world-renowned research. We're one of the sites here in your backyard that are one of the 10 sites in the world that have been selected to perform these very specific and targeted imaging for our patients. We're partnering with neurology practices who are treating those patients then with medicine to see if they can slow down the progress of Alzheimer's. So there's a lot of research happening in your backyard between ODU, Sentara Healthcare, EVMS, that we're kind of bringing the knowledge base, the technology, and the medicine all together to help improve the quality of life of our patients. So these are some of examples of some research studies that we're a part of, and we continue enrolling. And hopefully we will be able to find a medicine to slow down the progression of Alzheimer's and dementia in our community. So that is my time. Thank you again for participating in today's lecture. Here is a picture of the Sentara Brock Cancer Center, which is located right by the Sentara Lee campus in Norfolk. We are thankful for the opportunity to partner with ODU in the nuclear medicine program and other healthcare programs with the university as we partner together and work with educating our future and finding what new technologies and what new research opportunities we have and how we can change these statistics for our patient population. Thank you again. Any questions? I'm just going to look at the chat and see if there's any questions. Okay, I'm not seeing any questions. But thank you again for joining, and thank you again for the opportunity. And I just wanted to thank Sarah Maynard, who is the director and program director for the nuclear medicine program at ODU. If you are interested with any field with nuclear medicine or how to have this as a major, please reach out to Sarah Maynard. She is fantastic, and she will be able to provide you with information and resources of the Bachelor of Science program at ODU for nuclear medicine technology. Sarah, is there anything that you want to add to that?
No, that was a great talk. My email is smaynard@odu.edu. It's an exciting field. Francis and I get the opportunity to work together and do it every day. It's our passion. We love it, and we'd love to share the passion with you too.
Thank you, Sarah. And I went ahead and added your email in the chat. So that way, if anybody is interested, they can reach out to you directly. Thank you.
Thank you, Frances. Thank you for volunteering your time to share what we do.
Absolutely. Thank you again. Have a wonderful day, everybody.